Hello, and welcome to the Healthy Care YouTube channel. Today, we're diving into a crucial topic that affects the health and well-being of many individuals: needle sharing and its connection to HIV. It's essential to understand the risks, the science behind it, and most importantly, how to protect yourself. Understanding the risks. Needle sharing is the second biggest risk for HIV transmission, following anal sex. Shockingly, about 1 in 10 new HIV infections occurs in individuals who inject drugs. When you use someone else's needle for drug injections, steroids, or other substances, you expose yourself to their blood, and HIV, the virus that causes AIDS, can be transmitted through blood and bodily fluids. How needle sharing exposes you to HIV. When a person injects drugs using a needle, some of their blood remains in the needle and syringe. Since HIV spreads through blood, using the same needle as someone infected can introduce the virus into your body. Injection methods, whether into a vein, under the skin, or into a muscle, all pose a risk. Moreover, sharing tools like spoons, filters, or containers used to dissolve and heat drugs can increase your risk of HIV. Additionally, injecting drugs may lead to other risky behaviors, such as unprotected sex. Other infections and risks. Needle sharing not only exposes you to HIV but also increases the risk of other infections transmitted through blood, such as hepatitis B, hepatitis C, and tuberculosis. Tuberculosis is a respiratory disease, but intravenous drug use elevates the chances of contracting it. It's crucial to be aware of these potential consequences and take steps to protect yourself. Ways to lower your risk. The most effective way to protect yourself from HIV is to stop injecting drugs. Seek help for substance use disorder from a doctor, counselor, or community treatment program. If stopping isn't an immediate option, never share needles. Purchase new, clean needles and syringes from drugstores without a prescription. Many communities also have syringe programs or needle exchange programs where you can obtain new needles and safely dispose of used ones. These programs may offer additional services, including health screenings and medical care. Cleaning techniques and prep. If new needles aren't accessible, reduce your HIV risk by cleaning syringes properly. Follow a 3-step process involving clean water and bleach. Additionally, consider pre-exposure prophylaxis, PrEP, a daily pill that can prevent HIV transmission from needles or sex. Consult your doctor to determine if PrEP is suitable for you. Remember that drug use can lead to other risky behaviors, so using a condom every time you have sex can further reduce your risk of HIV. What to do if exposed? If you suspect exposure, don't wait. Visit a hospital or health clinic immediately. You'll receive an HIV test, and the healthcare provider will decide if post-exposure prophylaxis, PEP, is necessary. PEP can prevent the virus from causing infection if started within 72 hours of exposure. However, it's not 100% effective, so while on PEP, use condoms and avoid sharing needles to prevent spreading the virus. Understanding the risks of needle sharing and HIV transmission is crucial for maintaining a healthy lifestyle. Take proactive steps to protect yourself and seek help when needed. If you found this information valuable, don't forget to like this video, share it with others, and subscribe to the Healthy Care channel for more health-related content.